This is Radio Health Journal. I'm Nancy Benson. This week, the link between COVID and kidney function.
The early reports clearly indicate that the kidney is a major target of the COVID-19 virus.
How COVID is impacting kidney disease patients when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I think it's universally true across various industries, be it restaurants, be it retailers, be it households. People don't know how much they're wasting.
In the U.S., nearly 40% of food produced ends up in the trash. Then,
it's going 17,000, roughly 500 miles per hour. And as soon as it hits the atmosphere, everything starts to heat up.
Commemorating 40 years since the birth of the NASA Space Shuttle. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Even though COVID-19 is largely considered a respiratory illness, the virus can also take its toll on many other parts of the body. We know the effects of COVID are often worse for patients who have pre-existing conditions like heart disease or diabetes. Now, researchers are looking into the connection between COVID-19 and kidney function. Patients with COVID and end-stage renal disease are 11 times more likely to be hospitalized than people who don't have kidney disease. That's according to a study published in the journal PLOS1. Doctors also believe that patients with more severe initial infections are at greater risk for long-term complications.
If you get infected with COVID-19, what we're learning is that COVID-19 not only affects the lungs and the heart and the blood vessels, but there are also receptors in the kidney that can lead to injury to the kidney. The extent of that injury and the total number of people who will ultimately develop evidence of kidney damage is a matter of ongoing investigation. But the early reports clearly indicate that the kidney is a major target of the COVID-19 virus.
That's Dr. Griffin Rogers, director of the National Institute of Diabetes, Digestive, and Kidney Diseases. He says that patients with a compromised immune system, like those on dialysis, are at a greater risk for contracting COVID. Kidney transplant patients also have to take immunosuppressive medicines, which make it harder to fight an infection like the coronavirus.
They've not only had a chronic disease requiring it, but they're on immunosuppressive agents, which puts them at a greater risk for developing certain infectious diseases, such as viral diseases.
Rogers says it's important to understand the difference between chronic kidney disease and acute kidney injury. Viruses, infections, kidney stones, and low blood pressure can all cause acute injuries and lead to more permanent damage.
Acute kidney injury becomes a risk factor for chronic kidney disease. And conversely, if you develop chronic kidney disease, anything that can contribute to an acute event, you're more susceptible. So the progression of that chronic kidney disease becomes actually more accelerated. And so it's a bidirectional problem that one with chronic kidney disease can develop in the acute setting with these acute injuries. The common things that you don't think about, such as taking nonsteroidal anti-inflammatories like ibuprofen and naproxen for the relief of pain or fever, for example, if that is taken more than is prescribed or is recommended, that can cause additional damage to the kidney and thus accelerate the rate of progressive kidney loss.
Rogers says during an infection, kidney function may drop to as low as 40 or 50% of normal. The function may go back up, but it often doesn't ever go back to 100%.
It may settle in around 80%. And then, for example, if you have a second challenge, that might drop further to 30% before it recovers. So if these repeated episodes may lead to the development of chronic kidney disease and ultimately make you more susceptible to another acute event.
Scientists are still researching the link between COVID and the kidney, and it could be years or even decades before we completely understand the long-term health effects that may accompany the virus. But one thing is clear. Rogers says patients with chronic kidney disease should prioritize getting the COVID vaccine, if at all possible.
I'm not setting those guidelines, but we do know that people with a variety of chronic diseases like diabetes or high blood pressure, people who are overweight or obese, people with heart disease, their chronic illness itself makes them more predisposed to becoming infected. And that's taken into consideration by the CDC, who really sets the guidelines in terms of the prioritization of vaccine utilization.
Chronic kidney disease affects more than 37 million adults in the United States. Even outside of a pandemic, there are many daily considerations kidney disease patients have to keep in mind in order to stay healthy. To help manage their symptoms, patients should pair with healthcare providers to keep track of medication, diet, and exercise. But while Rogers says there are things patients can do, it's also hard to measure their effect because kidney disease often goes undiagnosed.
It's hard to know what the level of compliance is because many people with chronic kidney disease, because as we mentioned before, it's a silent disease. They may be unaware that they have kidney disease. So once they are aware, the compliance may be much greater. But some of the things that are important to emphasize is that if you have diabetes, which is the underlying risk factor for your kidney disease or cause of your kidney disease, making sure that you check your blood glucose and A1C regularly. If you have high blood pressure, maintaining the level of blood pressure that your healthcare team prescribes, as well as staying at a healthy weight. We've already emphasized the diet aspect of it, physical activity. And for most adults, this is 30 minutes a day, 5 days a week of modest physical activity, just like walking, for example, and getting 7 to 8 hours of sleep.
Even though there is no cure for chronic kidney disease, treatment can help relieve symptoms and stop its progression. You can find out more about Dr. Griffin Rogers and all our guests on our website, radiohealthjournal.org. You can also find previous segments there, and also on Apple Podcasts, Spotify, and wherever you listen to podcasts. Our writer this week is Libby Foster. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA withdrew the approval of fenofibrate when added to statins as the risks outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrate, such as Tricor, Entera, and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
A third of Americans think we will all be eating meat-free diets in the future, and the future is closer than you think. A recent survey of 2,000 Americans conducted by OnePoll reveals the average person thinks we'll all be meat-free by 2039. That's just 18 years away. Of the 52% surveyed who don't think that going plant-based is realistic right now, 1 in 5 worries that it's too expensive. But Vegan Strong National Tour Director and multi-sport athlete Robert Cheek says think again.
Plant-based eating can be incredibly affordable if you focus on eating fruits, vegetables, beans, rice, nuts, and seeds. Going vegan is better for your health, your wallet, and the earth.
During the pandemic, more than half of people have even made a game of cooking at home, and more people than ever have found themselves trying new foods they never thought they would. For more information, check out veganstrong.com. That's veganstrong.com.
This report is brought to you by Bristol Myers Squibb. Beta thalassemia, known in its most severe form as Cooley's anemia, is an inherited blood disorder characterized by low levels of a protein called hemoglobin, which plays an important part in the function of healthy red blood cells. While considered a rare blood disorder in the United States, beta thalassemia is much more common throughout the rest of the world, with an estimated 1 in 100,000 with the disorder. Patients often require frequent blood transfusions to help with symptoms of anemia, such as fatigue and breathlessness, and to restore red blood cell counts. International Thalassemia Day was on May 8th and was dedicated to honoring those impacted by these genetic blood disorders. Maria has been living with beta thalassemia since childhood.
One of the issues I have found is that living with such a rare disease means I often lean on my community for support and to help me find appropriate healthcare providers. I encourage others living with beta thalassemia to find their voice and take an active role working with their care team to maintain their health.
Craig Butler, National Executive Director of the Cooley's Anemia Foundation, adds,
patients with beta thalassemia may experience chronic anemia and fatigue, all while navigating a rare condition that is not widely understood. That's why it's so important that we educate people about this disease and support this community.
To find resources and support, visit thalassemia.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It will take a variety of different things to, in effect, give them a lollipop of some sort after they're vaccinated as an immediate reward.
Reaching herd immunity. If reason won't get people vaccinated, maybe incentives will.
Then, improving health care in underserved communities.
Where you live, in some instances, your zip code determines the quality of health care that you have and the access to health care that you have.
All that and more on Radio Health Journal.